The Schaufeld Family Advanced Pain Clinic is different in that we are able to take the time to drill down on what the primary problem is for our patients with these advanced, complicated disease and apply interventional therapies that they would not get readily if they had gone to other healthcare systems in the region. Sometimes the kinds of nuanced approaches that we can apply in this setting get lost in the bigger systems. But this symptom management piece and linking treatments to outcomes is just not a part of the normal system. And so we want to change that.
One of the things that really drew us to what Dr. Michael Byas-Smith is working on is just how important it is that people have the ability to choose how to live.
So when a patient and family arrive at our clinic, it's not that unusual for Chris, or maybe sometimes both of us, to be at the door waiting for them to get out of the car. And then they don't have that far to go. It's not like we have to go across the street to get them. They come right into the clinic. We like to interview and talk with patients in our treatment area. We have smaller spaces where we can interview patients and do physical exams, but we like the open space here. We like to play music for our patients. The decor is soft and gentle and it's convenient. Even patients who have to drive 45 minutes to get here, it's still a convenient space where patients can pull right up to the clinic door, able to get out, walk a few steps, and they're in, and we're taking care of them.
The atmosphere is very friendly, it's very home-like, it's not intimidating, it doesn't feel medical, all of which, really contribute to the quality of the care for the patient and their family.
Karen came to visit with us and she met with some of our patients, and they get it, it clicks. This is different. And the patients communicate, the families communicate how the convenience of the setting, it's a low-key environment. We don't pack people in our clinic and so on. And so when people come in and they visit and they look around, they say, this is different. Yes, it says Schaufeld Family Advanced Pain Clinic, but it's something even more special than that. And so families want it to be available, and the community wants it to be available.
I would love to see larger awareness in the community for the work of the pain clinic, for people to understand ahead of time, before they have to make difficult decisions, that there are options available to them, that they really truly are advocates for themselves and their families, and the pain clinic allows that.
When a person gets sick, it's not just the patient. Everybody around that individual is impacted in a major way. And so to the extent that we can help that patient to function better, to feel better, to communicate better, everybody benefits.
I thought that Dr. Michael Byas-Smith and his approach working with patients and families was sort of the best in class for healthcare. Oftentimes the system only will look at the patient, but the reality is that illness affects an entire family.
Especially the primary caregiver, whether it's a daughter or a son or a spouse. We invite the family to be participants in the care of that patient. And we use the families to help us to understand the patient better. And being in a hospice environment, that's kind of what we do. We take care of families, so it fits. I think that this place has proven to be of major value to the community. There are very few clinics like this on the planet. How can we make your life better for whatever time you have? Whether it's 2 years, 3 years, 10 years. We want you to have a high quality of living. And this infusion of resources from the Schaufeld family is really going to help us to make that happen.